Hello and welcome to Removing a Backboard from Under a Patient in Spinal Motion Restriction. This is Sean Halsman, paramedic and education guy, and I'm just doing a quick overview of how we can facilitate this move from a patient off the backboard once they're secured in the back of the ambulance, as will be our protocol. Remember, this whole spinal motion restriction thing is really, the object is to minimize movement of the spine during extrication and transport, and then they've done a really good job of leaving this up to us as how we're going to do this, and the best way for us on any particular call to make sure the spine's not moving. We have a lot of options in this, but ultimately collar's in place and we're just helping the spine to not move too much. With that being said, the backboards and the KEDs are not required to be used. They are tools that we have that we can use if need be, but there should be very few cases where you're going to have a patient actually on a backboard on your stretcher. And when that happens, we do have to remove them, and that is the purpose of this discussion and this video, to kind of talk about that. Now, per our policy, no patients shall be removed from backboards or other devices until the stretcher is locked in the ambulance. This is strictly a safety issue for patient care. I know the videos from the state showed this being done outside the ambulance, but quite honestly, there's very little chance for us to do this without some risk of dropping the patient or having them fall on the ground. The safest place for us to be is in the back of lighted ambulance, out of the rain, out of the snow, with the patient secured, and that way we're never going to have a patient drop or any other problem. And I think when you see this video, you'll see that this is relatively easy to accomplish in the back of the ambulance. So that's our policy. Put the patient in the back of the ambulance, lock the stretcher in before we move anybody off. Are there times when we are going to transport on a backboard? There's been a question that's popped up a few times, and yes, there are times where I guess it would be medically appropriate to transport somebody on a backboard. At that point, documentation is going to be the key. So let's look at this. So the scene of a pedestrian versus vehicle. Patient found unresponsive on long spine board with firefighters ventilating via bag valve mask. Patient moved to stretcher on longboard and transported on longboard due to concerns of impending cardiac arrest. That in your narrative makes perfect sense. That's a good reason to keep a patient on a backboard, because you assume that you're going to have to do cardiac compressions at some point. And if that is the case, then we've done what we need to do. So you've narrated that in your narrative and given a reason for it. This is not a problem. Again, your discretion as a medical provider is what needs to determine the best thing. Here's another scenario. Scene of a head-on motor vehicle collision. Patient under spinal motion restriction moved from vehicle to stretcher via backboard. Due to multiple extremity fractures and major trauma, patient transported on backboard, which allowed for mobilization of extremities during transport to trauma center. So again, you've got a patient who's got 2 broken legs, 2 broken arms, and is basically jello. You put him on the backboard, and this does facilitate a patient to be immobilized, or at least there's fractures to minimize movement on the backboard until they get to the hospital. They're not going to sit in that backboard. They're going to come off that backboard as soon as they get there. This is the spinal motion restriction T8 protocol for the state. It's online on ePro, so you can download it from the document section there. You can find it pretty much anywhere. Go through it. Just be familiar with it. There's not a lot of changes as far as what we're doing. The suspicion of spinal problems is still the same. So we're going to still be putting a collar on and doing everything else. We're just not going to be transporting on the backboard. So take a look at this when you get a chance and go through it. Make sure you're comfortable with it. This is going to dictate how we deal with spinal injuries in the field from now on. So we'll go into the actual move here. Now what we're going to see is a patient who is on the backboard. They've been placed on a backboard prior to being put in the back of the ambulance. There's a sheet that we used to put between them and the backboard. And there are 2 positions that are really important here. I'm in the way in this one position, just kind of helping facilitate and give instruction here. But the really needed positions are where you're going to see to the right of the screen Rob Casper, who is going to grab the sheet and hang on, and then you'll see paramedic Al Brown, who's in the back of the ambulance, is going to remove the backboard from the patient. So what you're seeing is Rob Casper is grabbing the sheet under the patient's arms, and he's going to hold the patient in place. I'm making sure right now the straps are not going to get snagged, because that is an issue sometimes when you pull the backboard out. So we're just looking through and making sure that the backboard straps are not in such a position that they're going to get snagged as you pull the backboard out. And what Al's going to do in a couple seconds here is he's going to simply grab the foot of the backboard and pull gently directly out of the ambulance. So he is standing at the back door and he's just pulling this out while Rob Casper is holding onto the sheet, And at this point, the backboard has been removed, and we've done it in a safe environment with lights and heat and everything else, and then we can adjust the patient as needed to make sure that they are comfortable, and we've achieved our spinal motion restriction. This is going to be the reverse angle, and basically what you're seeing is Al pulling the backboard out, and again, it's a little bit of a tug on that end, but this is the easiest way to facilitate it and get the backboard to move from the patient. A couple questions have come up. What happens if the patient doesn't have a sheet under them? In that situation, then we can do a couple things here. We can use the patient's clothing as a sliding device, so we can slide the backboard out from under their clothing. The second thing we can do is to literally run a sheet up under their arms and hold onto the sheet and hold them in that way, or we can have two providers in the back of the ambulance grab up under each armpit for the patient and hold them as well while the backboard is removed. But in any case, we can facilitate this with 3 providers, and sometimes even just 2 providers, getting that patient off the backboard. 9 times out of 10, we're going to have that help on scene to do 3 providers, but as you can see, I did very little in the actual move, and we were able to get that backboard out with pretty much just Rob holding on and with Alan pulling the backboard out. So this is a pretty easy move, and as with all changes, it's going to take some time to get used to it, but if you ever want to come in and work with this, please let me know, and I'll be happy to bring you into Commerce, and we can go over this and do it in real time. I want to thank EMT Jeremiah Kelleher, who was our patient in that scenario there. I'd like to thank AEMT Rob Casper, who was a patient care provider, and also paramedic Al Brown, who was the second patient care provider. And some kudos to Mike Kugel, who did the camera work for this particular video. As always, if you have questions regarding any training that we do here or any of our policies, procedures, please contact one of us. You got my email. It's shalsman@tcaems.com. You know my phone number here as well, so feel free to drop me a line, and we'll get you fixed up, and as always, be safe out there.